Because there may be instances where augmentation is not suprasystolic, it is important to note that the patient is still benefiting from counterpulsation support. As the balloon inflates and increases the diastolic pressure, mean arterial pressure also improves. As the balloon deflates, there is the benefit of afterload reduction. In the event that diastolic augmentation is not suprasystolic, it is important to determine why. Is there something that may be done to improve augmentation, or is this the best hemodynamic effect that may be achieved for this patient? To answer this question, it is important to consider the three factors that may influence diastolic augmentation: the patient, the catheter, and the pump. Always assess the patient first. Several hemodynamic parameters affect the level of diastolic augmentation achieved by inflation of the balloon. One factor is heart rate. When the patient is tachycardic, the level of diastolic augmentation may be reduced due to decreased left ventricular filling time and stroke volume. Tachycardia also shortens the amount of time the balloon may be inflated, which impacts the amount of blood that is displaced. Another factor affecting diastolic augmentation is stroke volume. A decrease in stroke volume can reduce diastolic augmentation. If there is less volume being ejected into the aorta, there is less volume being displaced by balloon inflation and therefore less augmentation. Tachycardia, hypovolemia, and poor left ventricular ejection are all factors that can cause a drop in stroke volume. Reduction in mean arterial pressure can also reduce diastolic augmentation, especially if it falls below 40 millimeters of mercury. Additionally, systemic vascular resistance can affect diastolic augmentation as a result of either vasodilation or vasoconstriction. After assessing the patient, consider the catheter. Anything that affects the ability of the intra-aortic balloon to inflate may affect diastolic augmentation. For instance, if the intra-aortic balloon does not fully exit the sheath, the membrane does not completely unfold. Or, if there is a kink in the catheter, the membrane may not fully inflate, resulting in reduced augmentation. Inappropriate balloon size, or the position of the balloon in the aorta, may affect diastolic augmentation, as would a low helium concentration or a leak in the circuit. Inappropriate timing of balloon inflation and deflation, and incorrect positioning of the intra-aortic balloon pump augmentation control are other factors that will impact diastolic augmentation.